Yeah, thanks a lot. I'll be quick, only 10 slides. Don't want to eat into your lunchtime, which is well deserved. That's, somehow the ecosystem we are placed in here. So that these are certainly, there are more networks than the ones depicted here. The arrows are meant, not whether one is superior over the other, but rather, top down or bottom up. That's from a manuscript that's impressed. And I think what we have heard from Richard and Bettina as well is that it is really important to not reinvent the wheel twice, but discuss and meet on a translational level and think about, what can we learn from each other. The beauty and probably most important thing about GenomeDE, with Mr. Zemmler and his crew is really stakeholder integration. That to me is the most important point of such networks, where the patient is really centered in the middle, but you do need to integrate, various groups and people depicted here to really make it a success. It's about reimbursement, we have heard this, it's about data infrastructure, it's about the sequencing, about treatment and so on and so forth. So many people, and you all have to get them on one table. And that eventually creates a unique ecosystem that to me is a lot about innovating things, right? It's not static, it is about driving things forward. And this is where these networks can lay a kind of foundation, provide a solid environment to actually achieve this. Briefly going back, contextualizing to what has been said earlier on genomic testing. That is a study conducted by ESMO on the test landscape in Europe, and everything that's red and orange is not available. Right? That tells you a lot about, where we are standing when it comes to cancer patients in Europe and their access to diagnostic tests. It is, very important that we drive this forward, and again, GenomeDE and all the networks that are integrated here will play a very crucial part in this, and it's really paramount, because otherwise it's not going to happen. We need to involve others. Reimbursement is an issue, health insurance, all these players, but I think it's important to realize where we are standing these days and what we are actually aiming for. The other point, and that has been mentioned also, is that while these networks lay a great foundation for diagnostics, for molecular reporting, for assessing variants, the other part is that it needs to be integrated with clinical trials at the end of the day, because we want to measure success. And you can only measure success if you can show that there is positive outcome, that there is a benefit, whether this is a response to some drug, whether this is progression-free survival, overall survival. I don't want to go into any details here, but it is important to really think this through and think about how we in the next or maybe subsequent steps can actually combine these two. A sustainable data infrastructure that has already been stressed by many, but again, that's an issue in all of the EU countries, right? And thinking about how we can maybe use, tools, environments that are already there in terms of software and so on and so forth might make a lot of sense. That's great work, again, from the Danish initiative, just showing, their data infrastructure. And we also have to keep in mind that we are placed in an ecosystem of regulations in the EU. And we have to think this, as well when thinking about all of these networks. And it's not just one regulation, it's actually quite a number of different, regulations, EU law, in other words, that will affect the stuff we are doing every day. And there are challenges related to this. So there are certain strengths, absolutely clear, but we also have to be very careful that our already very siloed and regulated healthcare systems do not get even more regulated and even more siloed. And there again, I think networks can greatly help to balance that somehow. So think about the the General Data Protection Regulation, the Datenschutzgrundverordnung in German, where we have a very specific way of interpreting this, although it is an EU law. And there, I think networks can greatly help to somehow balance the way we are interpreting this in a meaningful way, benefiting the patient on the one hand and protecting data on the other hand. And that's my very last slide now. As I promised, 10 slides, not more. Financing and sustainable financing and reimbursement is really critical. And I think, again, genomDE and the Modellvorhaben 64E have really made huge progress in Germany to actually achieve that. A nationwide health insurance system-based refinancing system which greatly will help patients, and we have to think about, on the other hand, how we will be financing infrastructure like data infrastructure, for example, which is a very critical component here in the future as well. And the main barriers are certainly, the link between stakeholders, and that's something that these networks can achieve, and genomDE and other networks have demonstrated that greatly. And the other important point is really that we need to show, and this is all about this pilot project, we need to show demonstrable benefit. Otherwise, we will not be successful, but I think we have a great environment. We have set the stage for actually achieving that. And with that, I'm closing here. Thanks a lot.